Microaggressions. Microaggressions and unconscious bias in healthcare and academia. This is a great event that has been organized as part of our Hispanic Latinx Heritage Month events and under the DE programming. So with this, I'll just turn it over to Kendra. Please.
All right, well, thank you, Kimberly, for that introduction. Again, my name is Kendra, and I work for the KU Cancer Center, and I will be moderating the panel today. So without taking much more time, I'm going to pass it down to Dr. Loaces, who is an amazing, amazing person, and she will be giving us an overview of what microaggressions is and all the definitions that we need in order to have this discussion. So, Dr. Loaces.
Thank you, Kendra. So Kendra and Tainara, as it gave me 5 minutes to talk about all the terms that we need to have the discussion today. So that's such an easy job, right? 5 minutes should be enough. So I think Alexa is going to share the screen with you all. She has a PowerPoint. I just have a few terms. It's very informal, and I welcome anyone to ask questions. If you have questions about any of the terms that I'm sharing. Somehow the terms are not there, so if you can keep on going, Alexa, that would be great. Just, yeah, until all of them are there. So one thing that I wanted to say before we start with the more technical definitions is that I think it's very important, like any other discipline, to have a shared language, to have almost like a technical language, professional language, to have these conversations. And I think this is especially important because these topics are sensitive. It's not the same thing to talk about these issues and to talk about, I don't know, recipes that we like to cook with. So I think it's important that we all agree in some words, and the ones that we're going to be, I think, using more today are going to be bias, unconscious bias, and microaggressions. But I do think this is kind of like my goal for this year is to maybe as someone who had to learn a second language, I think this can be another language or can be approached as something that we can all learn. And when we feel comfortable, we can start using it. So if we can go to the next slide. So the first thing that we got to discuss is what are biases? And biases don't necessarily have to be negative, right? There's positive biases and there's negative biases. Can someone think about one example of a positive bias, either through the chat or through voice?
Have a good one. So I sent my oldest child to El Centro Academy because I believe Latinos are better with taking care of children.
For example, right? So that's people tend to have this positive bias that maybe people from Latinx descent are very of taking care of kids, right? So there's another one that I can think of is like, if I ask everyone, like Asian people are good at what? So people would say math or music, right? So while they may seem positive, they're limiting anyways. So biases are tendencies or inclinations that result in judgment without question. Some of them are necessary. I need to know that there's a difference between a tiger and a dog, right? So I probably should run if I see a tiger, but not necessarily if I see a dog. So if you can keep on going, so that's my dog. So they're in general an automatic response, right? Or a shortcut. We need these shortcuts to survive. We receive so much information. Give me 1 second, please. So we receive so much information that we need to get these kind of like channels that help us summarize or process all this information in a way that is useful, okay? So next slide. The problem with biases is that as we use them more and more, our biases tend to become unconscious. So these are things that we do without thinking about, right? So generally we are unaware that we have them, right? And the other thing that is very important is that they can be at odds with our beliefs. So for example, I can believe or I want to strive to be a very fair person and be the same with everyone. But sometimes if I stop, or not sometimes, all the time, if I stop, I realize that maybe there are groups that I feel more comfortable with. Maybe I feel more comfortable with women who are from other countries, right? And these are things that it's not that I want to be like that. It's not that I want to have this maybe uncomfortable feeling while I'm around other people. So it's at odds with what I want to believe, but nevertheless, it does influence how I see the world. Next slide. So our biases, and this is more thinking about the context of healthcare, but our biases can lead us to engage in deficit perspectives. That means trying to seeing patients as empty containers to be filled, so they're passive, not active in their treatments, maintaining a focus on what they don't understand or what they don't have or what they're not going to do, as well as describing them from an ethnocentric perspective, meaning like our view of the world, and trying to impose ideas about how does a good family or a functional family look like, or what are good child rearing practices. And I mean, everything imaginable in our daily lives, we all I think the important lesson here is that we all have a lens, and if we don't embrace that lens, that means that we are unaware of it, but we all still have one. Then next slide. I think is the last one. Then we have this idea of microaggressions, right? And Alexa, you can keep on clicking if you want, and it will show some examples or some data. But these are, our biases may leak into microaggressions. So this thing, I really like this word, because me personally, until I found out this word, I wasn't very aware how to verbalize these emotions. So these are little things that tend to happen on a daily basis. They can be dismissful, they can be hurtful, but they're not your open, if you will, like open, blatant racism, right? These are the small things, the feelings that we get of not being included. Or they can even be meant in a positive way. Like I'm gonna give a personal example. I get this one a lot. Believe it or not, she's such a good writer, right? Because I have an accent, so people may be surprised that I can actually write, right? So there are small things that they're not always meant to hurt, but they still hurt a lot. And they can condition how we see ourselves and what we see as possible for us, right? Next one. So these are some examples, right? And I really like this quote that microaggressions are similar to carbon monoxide, because they're invisible, but little by little they get to you. I always like, also there's another image, kind of like a visualization of microaggressions that shows a hand with lots of band-aids. And it's an accumulation. It's something that keeps on going and going and going, and you get tired of it, but it can lead to stereotype threat too, exactly to the way you envision yourself and what you are capable of doing. So I think they do need to be addressed. So these are the terms that I have. Hopefully this is enough. So I think it's important that we try to use it. It's also important to know that there is not like a 100% clear-cut definition of these terms. People feel different about them, but I think we can think about them as a way to talk about the way our socialization and our world and our environment shapes the way we see things. Sometimes the way we see things is conscious, other times it's unconscious, and that it doesn't matter how little these things are. Sometimes these day-to-day little attacks can have a cumulative effect that can affect the way we see others, but also the way we see ourselves. So Kendra, that's kind of like what I have if people don't have questions. This is a very, very quick introduction.
All right, no problem. Well, thank you for giving us that overview. And then just to kind of go about with this panel, we also have some incredible people who will be able to provide us a little bit more about their experiences with microaggressions in general and also in academia. So I'm gonna just go ahead and present them. The first one that we have is Dr. Shannon Portillo. She's the Assistant Vice Chancellor of Academic Affairs and Professor in the School of Public Affairs and Administration at KU. We have Adriana Cuetos, who is an occupational therapist and a former Fulbright scholar at the University of Kansas Medical Center. We also have Brian Carcamo, who's a community health worker, who's currently working at the health department, at the emergency department at the KU Health System. And Tainara Formagini, a PhD student in health policy and management at the University of Kansas Medical Center. So Dr. Portillo, if you want to start in introducing yourself and just kind of give us a little overview, that would be great.
Sure. Well, thank you all for having me this afternoon. I appreciate it. As Kendra mentioned, I am in the School of Public Affairs and Administration as a faculty member. I'm also an administrator on KU's Edwards campus in Overland Park. And I grew up in Johnson County. My family moved here when I was in elementary school, and I went to KU for undergrad because it was the university that was 20 minutes away from my house. So it wasn't necessarily a big college search or choice. That was the public school that was right there. My father, who was a very overprotective Mexican-American man, said that I was basically not allowed to move out of the house. And my mother convinced him that college was a good enough reason as long as I wasn't going more than 30 minutes away. So it meant that I came home every Sunday for family dinner and went to KU for undergrad. I was planning on going to law school after undergrad. Like many children that I knew, I was given the choice of being a lawyer or a doctor, and those were the two things I was allowed to choose between. And I was not as proficient in the physical sciences as I'm sure many folks on this call are. So I decided to plan on being a lawyer, but when I was in undergrad, I was part of a really great program called the Dean Scholars Program at KU in Lawrence. And the Dean Scholars Program paired students of color with faculty of color to talk about different research careers. And so I was paired with a political scientist at the time and started thinking about different options and really wanted to look at Latinx youth civic engagement. And I was interested in looking at how my immigrant grandparents thought about voting and elections and how that differed from my parents and how that differed from my brother and I as third generation. And so how did we all consider ideas of civic engagement and voting? Because of some family issues, I ended up not going away for law school right after undergrad and stayed and started in the American Studies program at KU in Lawrence, and then had a faculty member reach out and said, "You're studying civic engagement, you should really consider public administration rather than American Studies." And I didn't know that we had a public administration program. It turns out we have the #1 public administration program in the nation at KU. And I switched to their PhD program and studied public law for my PhD. So my PhD is in public law. Right after undergrad, I ended up taking a job at George Mason University and started my career there in their criminology law and society program. My parents moved across the country with me and got a place 2 blocks away from me, which was very kind of them. And then ended up coming back in 2013 on faculty back at KU. So moved home, which was fantastic and a really great privilege that I know a lot of academics don't have the opportunity to take advantage of. So I've been back since 2013. I think about the question of microaggressions exactly the way that Maria was presenting it, a lot of those small things that add up. I remember in graduate school having a older white male professor tell me that I didn't have to wear heels anymore because I didn't have to try so hard, which I wear heels because I'm short and I like them. So it was a really interesting kind of "you are out of place here" comment. When I finished my PhD, some really great family friends who lived around the corner from us growing up threw a graduation party for me. And one of the members of my committee came and made a comment of, "Oh, I just assumed that you grew up poor." And he thought that I grew up in a different area than I did. And that kind of assumption around where folks come from was a really interesting thing because I had known this man for 5 years, the entire time I was working on my PhD. And this was just kind of an assumption that he felt completely comfortable saying in front of my family and family friends. So I think that there are just those kind of little pieces that add up. And the biggest thing for me is really noticing that I never had a faculty member who looked like me. And it's important that for all of my PhD students, many of whom are women of color, I can say that they won't have that same experience. So I'll leave that as my opening remarks. I look forward to any kind of questions or comments as we move forward in the panel.
Awesome. Thank you for sharing that. And again, we'll have time at the end to kind of make more questions specific to the panelists. So Adriana, if you want to go ahead and introduce yourself, that would be great.
Okay, hi. Nice to see all of you and nice to see friendly faces. It's nice to be back at KU for a few minutes. So I'm Adriana, I'm from Brazil. I'm a PhD candidate in leisure studies. Hi, Kimberly. And I went to KU under Dr. Lisa Michelot's mentorship at the OT education department because I got a Fulbright dissertation award. It was great. And then, but when I knew that I was going, I was terrified, totally terrified. I had been in US before and I was terrified to go, and I kept thinking about racism in US, and this time I was going with my daughter. She was 4 years old. So that was the big moment for me. And as soon as I got in, it was totally different than I thought, which was great. So my daughter had her first Black teacher. And that was such a good moment for me because I wanted her to have this role model to see Black people in high positions, because for me, teachers are in high positions. So I also had experiences that I can't count, like getting to know the women of color group. Oh my goodness, I wish I could go more. It was great. And then having my mentor really helping me to navigate through hair issues, because I couldn't find any product that worked with my hair. It was such a deal. It doesn't make, probably, you know, for most of you, it doesn't sound like it, but it was, because I couldn't feel included because I couldn't find anything for me. And then, but I was intrigued. I experienced so many things during the day today, you know, at KU and outside. I think my Fulbrighter experience was outside of KU as well. So I experienced so many things. And when I came back to Brazil, I reached out to a professor of mine and I told her about my experiences. And she still is the coordinator of a student group, and they make events. So they started doing events about racism in OT. So racism among OTs, not just talking about clients, but talking racism among us. And that was such a big deal that actually led to another event about racism, OT, and occupational justice. And now we have, because of all these events, we had more than 9 lives talking about it, talking about racism and microaggressions and all in that shared language that Dr. Lewis has shared with us. And now actually a federal university changed the selection of professors. That's great because we fought for it. We created the first Black OT group to represent Black OTs in Brazil. And now we also had this same federal university created a class to talk about racial issues and OTs. So I think I just bring my experience today, how this, 7 months, because my experience was cut short because of COVID, and this little, but such a big experience created so many things. I think that sometimes we think that we are small, but we are not. So our experiences are so important, and it's changing, at least I think, it's changing a bit here in Brazil. So that's it. I don't have much to say. Probably cut a lot of the things that I was going to say.
Wow, that's just amazing how many things to accomplish in such a short time. And thank you so much for sharing that and continue pioneering for people's rights. Brian, do you want to share a little bit more about your experience?
Yeah, so as Kendra introduced me, I'm a community health worker here with care. So I work in the clinic case care sometimes, and I work most of the time. I moved here, like Shannon, brought me here when I was in elementary school when I was 8 years old. I only knew one school in El Salvador. I am from El Salvador. Moved here, it was very, very different. I moved here, it was snowing when I moved here, so that was a big thing for me. Besides that, so I went to Rosedale Middle School. I actually went to Argentine Middle School.
Hey, Brian, a little bit. You may want to just stop the video because I think you're getting cut a little bit. We'll see if how the video works. Thank you.
Yeah. So like I started elementary school. It's right around the corner from KU here. That's where I went to elementary school. I went to middle school in Rosedale in Argentine here in the Wyandotte County. Besides that, after a while, we moved to actually Johnson County. I went to Shawnee Mission School District, which was a big, big change for me, going from Wyandotte and knowing who I can hang out with, who I can speak the language with, all that good stuff, going to a 6A school, which I didn't know that you had to try out. Kids, I love to play soccer. It was a big, big change. Good, you were going to make varsity team. And when you go to Johnson County schools, Blue Valley schools, and all that good stuff, you have to be, they ask you, what club have you played on? I'm like, I don't know what a club is. I'm just here to try out and try my best. So I thought I was so good. I didn't make the varsity team, obviously, but that did not discourage me. It just made me fight even harder. Way up when I was in middle school, in high school. Eventually, my senior year, I did become a captain, which was a big thing because that's when I started feeling more microaggressions, saying, why is that kid a captain? Like, I've been here. You guys been going to elementary school with me. Like, why you guys didn't vote for me? But they saw how hard I fought for this and all that good stuff. Another microaggression that I would say in high school, even when they talked about Brian, they will say, oh, no, the Mexican Brian. Just because, I'm colored, brown skin, black hair. And I'm not. You just see a color skin, boy in high school with, a lot of where the white, Caucasian. So that's the way that they were, Mexican Brian. So by the end of high school, eventually I got to let everybody know, if you want to call me something, don't call me Mexican Brian, just call me Salvadorian Brian, what I am, because I'm proud of that. Was this one of the microaggressions that I, grew up with and stuff like that. And the academies, I guess that's the microaggressions that I, lived through in the academy. Other than that, let's see, just kind of my mom helping go to the clinics, and, they're like, oh, okay. Like, even when I was struggling to translate from my mom, like, now that I know, you could just ask for an interpreter. Like, that's easy as that, or like a nurse or the doctor could just, get a webcam and, it's easy to get words out to actually help my mom out. And now, like, it was so frustrating for me now when I was young. So just going through that. But at the end of the day, I just don't see it as a discouragement. It just made me who I am. Just not knowing the language, I still tried my best to, in a way, just, learn words, learn the language. Because sometimes I tell myself, I don't know English all that well, nor Spanish. So it's still a learning process. You can only get better. That's a little bit of that. Did you get that?
Thank you, Brian. If you don't mind calling the Zoom phone number, that might be best. So at least we can have you on the call. That way we don't have any other experience with cutting off when people are asking you questions. That would be great.
Sounds good. I'll do that.
Thank you so much. And then, so last but not least, Tainara Formagini, if you want to go ahead and introduce yourself and that would be good.
Yeah. Oh, sorry. Hello, everyone. My name is Tainara. I am also from Brazil. Brazil is like represented here today. I lived in Brazil my whole life. I moved to the US in 2012. I was doing my undergrad in Brazil, and there was a research opportunity to come to the United States, to KUMC, to study 1 year here. So I came, was my first time, everything new. My English wasn't even very good, but it was a great experience. Spent 1 year here, went back to Brazil, finished my undergrad, did my master's, and then I came back to the US in 2016. I worked 1 year as a research assistant at KUMC, and then I transitioned to the PhD in health policy and management. So it's 5 years in the US total. I have many experiences to share, I think. But honestly, I think most of my experiences, or a lot of my experiences, are outside academia, which that's one of the first points I wanted to make. I think from my experience, my perspectives, I am protected in some sense through the people that I hang out, the people I see, that my mentors and everyone. I think I am, in general, I have more positive experiences than negative experiences. Now, if I talk about outside academia, I would need like a full hour to talk about all the experiences. But I wanted to share one experience I had that I think it really got to me. As Dr. Luaces was saying, it's like small things that just add up together, and it really affects you. So early on, when it was my first year here, my second year here, I had a colleague working with me. We were relatively close, and she was helpful in some senses, like helping with my English and improving my English. But it was also sometimes that it was used as like to make fun a little bit in the way that I talked and how I talk, or if I missed like a word and everything. So she did this like more than a couple times. And I mean, back then I didn't know what microaggressions were. I think I didn't think much of those experiences other than she's trying to help me. She's native, I'm not. So just trying to, a couple times it was like, well, maybe, just dumb. I'm a little dumb. I need to learn English, and that's fine. And then I think throughout the years, I can see how that has affected me, but I couldn't use a name to it, right? And I think it was not like until a couple months ago, they started actually learning what microaggression is, and like all these experiences make more sense to me. So I'll give you 3 examples that I think how these experiences over the years have affected me. Number 1 is with my ability to speak in English in public, like I'm doing here right now. I'm super nervous, as you probably can notice. But if you know me in Brazil, or if you're able to talk to me in Portuguese, you see that I'm probably even like a different person. I love talking. I love being the center of attention. I love public speaking. I love teaching. But when it gets to English, it's like I have a different personality, which is very interesting to me. I think over the years, I had to do many presentations for classes and everything, and I'm always so nervous. It could be small, big, and I think that does change, like even like my ability to speak English. I started like messing words around and everything. Another one that I think it's very obvious is when I am participated in presentations like this we're doing today, and then I usually don't ask questions because I am afraid I'm going to be like the center of attention. Everyone's looking at me. I'm going to mess it up. I start overthinking. And the third one, which is I think the ones that hurt me the most, is I had a TA experience, like as a teaching assistant for one of my PhD classes a couple semesters ago, and my ability to teach was really, really low. And again, that's one of the things I love. That's part of the reason I decided to do a PhD. And I doubt myself the entire semester. Like, can I do this? Should I even be in the PhD? I can't teach. Because every time I got in front of those 20 students, I would be nervous. I would be like doubting myself. And I had the feeling they were all judging me, which is probably not even true. But it really like got me. And I think even like listening to Dr. Luasis talking today, it makes even more sense, right? Like how those things actually are like shaping, ended up shaping who you are, I think. Yeah, I think that's what I'm gonna share for now.
All right, thank you for sharing. And then we're gonna hand it over to Dr. Loasis again. She has a couple questions that we'll be asking the panelists and also the people that have joined us. So Dr. Loasis.
All right. So I did have a lot of questions, but some of them had been answered already. So this tends to happen organically in panels. So I think that in the interest of time, since it's already 12:30, what we can do is I'm going to ask a question, and then Kendra, if you will be so kind to maybe copy paste it in the chat so people can see it too, and then maybe get input for one or two people and then move to the next question. So we have time to kind of like go over a couple of topics, if that makes sense. Okay, so the first question that I have is, so can one of you or several of you talk about when you learn about bias? Sorry, I'm out from my phone. So when you learn about bias and microaggressions or subtle racism, or when you started to recognize you or others were facing those in your daily life or in academics, can you share a couple of examples of what made you start thinking about these issues in your personal life or as it relates to provision of healthcare? So in other words, sorry for all the interruptions. So when did you become aware of microaggressions, and when did you become aware that you or others were victims of microaggressions, and what were these personal stories of circumstances when that happened?
So if I could start, this is Shannon Portillo again. My mom is white and my dad is Mexican American. And so I often saw the different treatment that they had when we would go places as a family, often like, especially if they were in stores and not standing right next to each other, it wasn't obvious they were together. So I think from a very early age, I kind of saw that from a personal perspective. I think I thought that I wasn't experiencing a lot of that in school, particularly once getting to the university, because I think I had this expectation that universities and academia are these safe spaces. And it was actually in talking with other students of color that I realized that responses from faculty were different towards me, that we had some of these shared experiences. I think that there was a question in the chat of how do we respond to microaggressions? And I think part of this is really tough because in the moment, it's often difficult to recognize them as microaggressions. It's usually, when you go home and you're unwinding from the day and you go, that was really messed up. That wasn't right. It's not that quick in that moment. How do I respond? How am I ready for that? So I think part of is hearing from mentors on how to be prepared and how to recognize some of those, and hearing from peers about their experiences and how our experiences are very different than white colleagues. And so knowing that white students experienced a very different university than I did and a very different graduate school than I did.
Hi, Adriana. I would say that college for sure was the beginning of noticing things. I would definitely see the difference between the treatment towards a white colleague and myself. They would have more autonomy to do things, have access to information that I wouldn't have. And then when I started to travel for academic purposes, that also came to me. But I just elaborated, I just thought about it afterwards, because I would think that was culture shock. So maybe it's a culture shock. Maybe I am overreacting. Maybe it's just the way they are. So I guess that. And when I became aware of bias, I started to think how biased I was towards other people. And I actually started thinking about, was I biased to my mentor in the US? Because I always consume Hollywood movies. And was I expecting her to fit in a stereotype, just like the Hollywood movies? That's one of the things, yeah, that's one of the things that came to my mind. Like, yeah, and then I can see some moments that I definitely was. Not consciously, but I think I was.
That's such a good comment and such a good self-reflection, right? That it goes both ways most of the times. That it's not just how it feels on us, but sometimes we, because most of the things are unconscious, we tend to do that upon others, right? And that's part of the growth that we need to work on. So one of the questions that I'm personally very interested in is how people feel about microaggressions versus, for example, just a blatant prejudice. So there's literature out there that suggests that people experience more harm through microaggressions that they experience through openly racist comments. So I wanted to hear what are your thoughts, different people in the panel, about that statement. Do you agree? Do you disagree? What do you tend to find more hurtful, or what have you found in your experience more hurtful?
So I think if I can, I'll start on that one. I don't know if I can say which one is more hurtful. In my experience, I think, because I don't think I face a lot of direct prejudice and racism, right? And which is a privilege to me. I think, I'm pretty pale. If I don't talk, people are not really sure if I'm here or if I'm from here or not from here. Now, I think microaggressions are tricky because a lot of people, it's difficult for other people to notice. So I'll try to share two quick examples I had. One was when I was trying to get and I just want to make a point, Juliana made a really important comment here, because it feels something is not right, but it's difficult to express what's going on that moment, right? So the first one I had was when I tried to get my driver's license here in Kansas City, and I didn't pass. The lady treated me, to me, I couldn't put in words how she was treating me at that point, but I know I was again messing my English, but I was also messing like driving because I was so nervous and feeling the way she was treating me. But by the end of it, I couldn't even say anything. I just started crying. And then my fiance was with me, and then he could not understand why I was crying. It's okay, you didn't pass. And then I tried to put it in words, and I felt like that was the first time that it hurt me. It literally physically hurt me. But for other people, it's difficult to see. And I had another experience that wasn't on academia, but it ended up being part of my academia. I had my bridal shower, and my in-laws were preparing it, and then they paid someone to do the invitations, and then on the invitations they put a monkey on the invitation. And if you don't know, there's an association between, in Brazil, you live in Amazon or whatever. I'm not gonna get into that. And I remember just seeing that, and again, crying, trying to explain how that hurt me, because it's by the end of the day, you're not from here, right? And I remember talking to my mentor about it and crying with her, and she was very understandable, but at the same time, she could not picture okay, tell me this is wrong, but tell me why this is wrong, because it's difficult, right? For other person to be yeah, it's ugly, but explain to me why this is problematic.
Anyone else wanting to share?
I'll share one example that came to mind as I was listening to. When I was interviewing, I was doing my residency interviews. I'm sorry, fellowship interviews. I was in neurology residency. I was doing my fellowship interviews, and I was in New York City, one of the hospitals there. And in my CV, it says I was chief resident, the last year of residency. And it was a unique interview experience because there's actually two people at the same time, which it was never like that. And it happened to be two men. And one of them said, so everybody was chief resident there last year? And I remember looking at him well, no, if everybody was chief resident, why would I put it as an honor? I was chosen to be chief resident. And I did, like you said, Tainara, I couldn't put two and two together at the moment. And later I thought, why would he ever ask like that? you know? So,
Thanks for sharing. That's a really, really good example. So I'm thinking, anyone else wanted to share?
I just wanted to comment on Carol's point. Hi, it's Tamara. That sometimes it's confusing because, you know, a lot of us are also women. We're from another underrepresented group. So there's this very complex interweaving of sexism and racism and, you know, other isms that are all kind of imbricated in. And so, Carol, it's interesting that you brought this up, because part of me is wondering, well, is it because you're a woman? But, you know, I guess context really matters in all of these situations.
This is Shannon Portillo. I did want to go back to the comment about microaggressions versus kind of blatant racism. And I think one of the things that I feel, and I think is pretty supported in the research around this, is that with the blatant racism, you know where you stand. And with the microaggressions, it's always a question. And so it's that question of trust, and that you start questioning yourself of, why did this happen? Am I overreacting? Is this real? But then you also don't know who you can trust as an ally. And in particular, when we're thinking about educational spaces, work spaces, I think that the story earlier about, you know, a colleague early in school kind of always making comments about language, those are things where we don't know who we can trust when it's a microaggression, and that erosion of trust makes it even more difficult than those instances of blatant racism.
Maria, this is Geraldine. I just wanted to add something real quickly. For me, I know I'm not Latin. However, I have experienced, of course, microaggressions and racism. And for me, through my years, what has been most challenging for me has been microaggressions and incivility. I don't want to say I can deal with racism, but racism is just very blunt. You kind of know where the person stands. It's those microaggressions and that incivility where you don't know, like you just said, that you don't know who you can trust. And then it kind of just gets to your core over time. And so that's the most challenging part for me that I've had to deal with over the years, are the microaggressions and the incivility, the things that are said and done that are undercover, or those things that are very covert, are the things that erode my core.
Anyone else? I think maybe Leticia, were you wanting to share?
Thanks, Maria, and hi, everyone. I appreciate so much having this conversation with you all. Just from the perspective of academia, what I've seen or lived is detecting the microaggressions by proxy, as you can see from my picture. And very similar to what Tainara said, is when you pass as a Hispanic woman, as a Latina woman, sometimes people don't even question where you're from, that you're from an out group. And I've had instances in academia where people make comments such as, well, you read that email, they don't know English, so we probably don't want to admit them to our program, or things of the sort. These things do happen in academia, and it's not as likely to that you will see them if the people that are, you know, perpetrating these microaggressions or blatant acts of racism consider you as an out-group person. And so one of the things that the longer I stay in academia, the more I'm seeing a little bit more of that underbelly of how these microaggressions and the bias, the unconscious bias, plays into who makes it into the academic positions and why. And so those kinds of interactions are very painful, because, like you all are mentioning, it's really hard to put your finger on it. And one of the biggest challenges I have is, so what now? What can I do? Now that I have my finger on it, now that I have a list of multiple microaggressions through time, what can I do now? Because this person is someone that I'm going to have to interact with. What can I do?
Can I comment something? And I was even thinking if I was going to share that or not, but hearing Leticia inspired me. So I had a situation in academia that I was part of a training. I'm a dietitian, and then I focus my work in Latinos. And then I was part of a training of how to use a system. And I was doing several questions because I was already brainstorming some of the foods that I was going to see in the population I study. And then I started to ask, and then this person, she was like, I don't know why your people eat like that. And when I heard that, I was like, I didn't have a reaction right away. And I had this feeling like something's not right on how she speaks, because I was asking questions on how to improve and then making the assumption like my people. I work with Latinos. Latinos are more than 19 countries all grouped together in one group. And I could hear also in the speech like a bad food, a bad way of eating and perceiving as bad as well. But then it took me like a long time, because I was like, oh, maybe I was asking too much. Maybe I was not behaving in a good way, like making questions. And I had the same difficulties that Tainara had, especially in my first year. I would always like think 10 times before asking something because of my accent, because I'm not from here. And it's hard because it's a person that I had to keep interacting, and I was being trained by. So even how to reply, it's tricky. And I didn't know what was microaggression at that time, but I learned in the hardest way.
Other comments anyone else wanting to share?
I'll just say that as we're on the chat, we're making connections between each other to support each other. And we need to just ally with one another. And again, I was the one that asked about strategies, because I keep thinking about people discussing language and the fact that many of us speak more than one language, and the people that are criticizing our dominant language know only one. And so I think there are very interesting ways you could kind of respond to that, like, well, I know multiple languages. Do you? You know, maybe that's harsh, but there's got to be a way to educate people so they don't do this anymore.
I personally have used that one. I don't know if it's polite or not, but I have.
Good. That's awesome.
So one of the, I'm here and I wanted to have time to ask a couple more questions, because your examples are such good examples. And I think that, and such examples of reflection. I wanted to know, maybe if you could share with the audience how these microaggressions or insults have affected you professionally or maybe personally. I know Tainara shared some like feelings of insecurity maybe when you have to speak in public, and that's something that I have personally experienced. Then many times like feeling like I shouldn't be taking the lead, letting other people take take authority for the work that I did just because I don't want to be at the center. And I think that's something that a lot of people experience in academia. And I see the difference with I'm in a group with women who I feel connected to, for example, in my case, and I feel comfortable and I'm a lot more productive there. So how have microaggressions impacted you? Can you provide examples and maybe give us some tips of how do you get out of that situation? Or how do you overcome that or start to?
Well, I think in lots of ways, microaggressions help you find your people and help you kind of know who you can trust and who you can't trust. And so that's really great. I mean, on the Lawrence campus, I only have data from a few years ago, but we only have 8 Latina tenure track or tenured faculty members. So I can name every single one of them. And I don't think any of my white male colleagues could name all of the white men who are tenure track or tenured. So I mean, there is a sense of being able to find your people and have a space in community to have those conversations. One thing that I tell my students a lot is that like these are things that happen in academia. I think there are things that happen in healthcare. There are things that happen in public administration, but there are things that happen everywhere. So there's not, leaving the academy is not a way to escape microaggressions. So I think we need to stay and make the institutions that we are a part of and that we care about better. And for me, it's that aspect of knowing that I have experienced things that hopefully my students will not, and hopefully they will make it better for their students and moving forward. And so thinking through that, how are we leaving the place that we are in right now?
I really like that idea of the group, because that's something that I have experienced myself, and even not using, but being strategic about the way we can lean on people within that group that may be already in positions of power to help you in. That's something that personally I have found something really useful. Any other
This is
comments?
Brian.
Okay.
This is Brian Carcamo. I was gonna say the way it has impacted me or motivated me, in a way, it's just to keep advocating for quote unquote my people. Now that I'm in a position here at KU, graduated from UMKC, know that I could, if you put get through it, you put yourself through it, then you can do it. Now that I'm in this position that I could advocate, talk to nurses, where the nurses don't have to look, upon the patient just because then I could step in and be like, well, this is what's going on. Like, if the patient can advocate for himself, I will do it, because I've not only been there myself, but I've been with my mom. So just because a person, is there, can explain, is afraid to like even speak if they know a little bit of English, because they're gonna butcher it, they might not understand, or they might get in trouble because of what to say. So now with where I'm at, I feel like it's my right just kind of plant the seed and keep going from there and advocate for my people and just help in my community in general. That's the way it has motivated me and impacted me.
Anyone else wanting to share?
There was a question from Jaime in the chat box. If the panel has discussed what worked for them for coping, I don't think if anybody of them can share.
Oh, I honestly think it's sharing. Honestly, I think it's there is something therapeutic about even just talking to people about it. To me, that's what has worked best. And obviously, the people that will understand you most are probably the people that face it similar, but not necessarily, right? I have shared with other people that that not necessarily understood, like the example of the monkey on the invitation, and I felt what is the word, like someone was there to hear what I'm saying and acknowledge it, if that makes sense.
Thank you, Tainara. I think something that worked for me in the past when I got discrimination was also something that someone else just mentioned recently, and it's the advocating part. And I turned into, this was not a microaggression, but what I ended up was advocating for immigrants in this case, so that what happened to me wouldn't happen to other people. And I think that empowered me. Obviously, having someone that listens to me, a group of friends who experience similar kind of discrimination, or my wife, most of the time she understands me because she's very understanding. So that's definitely very important. Someone someone that you trust and that will understand you. So I completely hear you there. Thank you.
One thing that has worked for me has been to look for almost counter stereotypes. So if I start feeling a certain way about myself, or I get to start feeling that people have a certain perception of me, or where I come from or who I am, I look for counter stereotypes, people that challenge these assumptions, and I try to find almost inspiration in looking at them at their work, and I try to surround myself by this type of people because they encourage me and they inspire me. So being very intentional, particularly professionally, about who do I surround myself with has been very useful for me.
Do you feel, and this is obviously not possible for everyone, but do you feel better when you go to Spain and you're not discriminated for your ethnicity for a while?
I think that that's a good question, because I think that someone before talked about all these intersectional identities that we have. So I think depending on the context, there's certain identities that matter more or less, if that makes sense. So I can be in a context and feel like, I don't know, someone is throwing something at me because they feel I'm a mom of 3 kids and I don't have time to be, to talk about professional stuff and I should be in the park. Or so I think it kind of depends on the context and which identity, which one of my identities is more salient in that particular context. Hopefully that made sense.
Absolutely.
That's an interesting point, Jaime, because like one of the experiences that I had after being here for 2 years and going back to Brazil, not for microaggression, but for racism. Obviously, like in Brazil, I never experienced racism, but I started after leaving here, when I went back, noticing interactions of racism that before I didn't notice. And I think by the fact of living here and experience like microaggressions or situations that I felt discriminated, when I went back, I started to notice those interactions and comment that that was not right. And before I didn't have that view. So I think it led me to reflect a lot interactions in my own country.
Kendra just posted another question about resources that you think should become available at our institution.
I mean, I think there has to be a place to gather so that because a lot of you said things about finding a community, finding, somebody that's gone through things like this. And I had a meeting for something different that brought different underrepresented groups, physicians throughout the system. And I thought to myself, how have I never met these people before? Why did anyone never, put us together? And so I think opportunities to bring people together who may want to share certain, experiences.
This has been a really good conversation. Unfortunately, it's already been an hour. We need kind of like the whole day just to kind of discuss. We just barely dug into like the main things, but there's just so many layers that we need to focus, and hopefully we can continue having these conversations with everybody and make it more of a daily thing where we can feel comfortable to be discussing it and not just feeling like insecure or feeling like you're the only one experiencing it. So again, thank you for everybody for participating, for Dr. Loazes for leading the discussions, and for the panelists, and just the Kimberly and her team just giving us an opportunity and space to be having this discussion. So thank you everybody for joining us.
Thank you.
Thank you.
Thank you.
Thank you.